The Ohio State University Wexner Medical Center has been at the forefront of advancing patient care, research, and medical education for the people of Ohio and our region. And now a new leader is stepping in to continue the medical center's impressive momentum. Joining us today is Dr. John Warner, who will serve as the new Chief Executive Officer for the Wexner Medical Center and Executive Vice President at Ohio State. Thanks for joining us, Dr. Warner.
Thank you. Glad to be here.
Initially, what was your interest in Ohio State and what drew you to this?
Well, if you're someone who's been involved in academic medicine, you know about Ohio State because it's a university and a medical center that's well known for excellence and innovation. So when the call came to see if I was interested in coming here, I already had enough content knowledge to know a little bit about the place. But as I began to go through the process, I learned even more about the breadth of expertise, the commitment to advancing science, and the commitment to impacting healthcare in a very positive way. So I knew a little bit about Ohio State because if you're in academic places, you know about good places like Ohio State. But then as I became more and more interested in the opportunity, the more I learned, the more interested I became.
Personally, though, where did your interest start?
So my interest in science and medicine is a little different than most people. I was always, as a child, interested in nature and science and nature. And as I sort of went through school, junior high, high school, I had amazing science teachers who helped cultivate that interest and help me think more broadly about how you might apply interest in science to a career. And so I sort of left for college thinking actually that I might be a forest ranger or something like that because I was so into the outdoors and hiking and fishing and all those kinds of things. But as I went to college, I, again, stewarded by professors and great mentors, began to help me, challenge me to think about how I might take science, my interest in science, and use it to serve others. And so that's where the interest in medicine came, and that was really how the seed was planted.
So mentors were pretty important to you as you were growing up, but growing into your career.
Absolutely. At every stage of my life, including where I am now, I've always had wonderful mentors and friends who've helped me think through opportunities, ways to grow, ways to improve, and ways to have an impact. That was particularly true in medical school and in college. In college, I had, great professors that really helped me, challenged me to think differently about problems and how to grow and how to cultivate that interest in science. And then in medical school, I was just lucky enough to be paired with, during summers, with great researchers who really not only taught me the importance of research and how that translates to improvements in medicine and improvements in care, but also the value of academic medicine. My wife and I used to go to their house for seminars and things like that, and we would always leave saying, that's what we want to do. We want to be those people. I'm involved in teaching, education, research, and patient care in meaningful ways. So I've always had people around me that were great role models and really helped me become the person that I wanted to be.
So that leads me to my next question, because you mentioned academic medicine, and this is very important to you, and it's been a central focus, obviously, throughout your whole career. When it comes to that three-part mission of academic medicine: education, research, patient care, why is that such a focus for you?
Part of it is I think I had such great experiences in all of those three missions. I loved training. I had, medical school, internship, residency, fellowship was just this incredibly stimulating time for me. And I was surrounded by smart, interesting people doing impactful things. So that was important to me. I had a very positive experience in research, even though I've really not had that has not been the main focus of my career. I learned early on the value of research and how important it is to the ecosystem of medicine and improvements in patient care and saving lives. And then I've just enjoyed clinical medicine from the moment I sort of arrived at medical school. So I think part of it is I've led a training program. I've been involved in clinical research. I've been a full-time clinician. So I understand all the value of those three missions, and I also
and the symmetry in those.
That's right. And so when it works well, all three of those things are clicking, and people so that's been part of my own commitment to that.
Let's touch on your role and approach to leadership. How would you describe your leadership style?
Well, I like to think of myself as a very relationship-based leader. I very much like to be out and about, developing and learning from others, developing relationships, learning from others, as opposed to sitting in my office, that sort of thing, in meetings all the time. So I think what people at Ohio State will see from me is I like to be out seeing the work firsthand, to really understand what's going on, what the needs might be, and how I could best contribute to solving problems or advancing ideas. That's the way I work and the way I enjoy the work the most.
Would you say you have a hands-on leadership style?
I definitely am much more hands-on and very transparent. I'm a big believer in people really that the why you're doing something is important, that everyone should know. And so I like communicating that why. I like making sure that people understand what we're doing, why we're doing it, and how we're doing it. And so to do that, I think you have to be out and about and with the people actually doing the work and leading the efforts.
What leadership lessons have you learned along the way that you're bringing with you to Ohio State?
Leadership lessons I think I've learned along the way as transparency is really important, and particularly in medicine. People really need to understand why you're doing something and the impact it could have. And that's not marketing, that's real understanding. And so I think, when I've done my job well is when I've been able to communicate the reasons we're doing something, why we're prioritizing something, and how we're doing it, and the impact that it could have. So transparency is really important to me. I also am a big believer in teamwork. Medicine is a team sport today more than ever. And coming out of the pandemic, we've all learned ways to be better team members, I think. And so I'm a big believer in creating those teams and making sure those teams have the ecosystem to be successful.
Part of your success in leading some of these larger health systems is that you focus on patient-centered care. I want you to describe what you mean by that and why that's so important to you.
To me, it's always putting the patient and their family, their ecosystem first. And that's easy to talk about, not always easy to do. But to me, it's always thinking about the impact that a decision could have on a patient and a family, the impact that an opportunity could have on improving their lives, and always keeping that in the forefront and challenging yourself along the way. Is what we're doing always in the best interest of the patient and their family or their friends, their loved ones? And that's something you have to work at. It's not something that always comes naturally. Doctors sometimes tend to think about, how would my work be easier? And so you have to flip that and think about everything being in service of patients first.
Especially when you have the research tied into the education, tied into the patient care, all of that together.
Absolutely. It goes to that teamwork. Those team members, the research team, the education team, and the clinical care team, all being intertwined in a way that's all in the service of patients and families.
So before we wrap this up, I'm curious if you could speak directly to patients, members of the community. How would you describe what they can expect from Ohio State under your leadership?
Well, I think patients and families and the community can expect a medical center that's committed to excellence across all those three missions. The very best place to receive care, the very best place in terms of cultivating and advancing research advances, and the best place to learn to be a health professional and to generate the next generation of healthcare leaders.
Thanks, Dr. Warren. It was a pleasure to meet you, and thank you. And welcome to Columbus and to Ohio State.
Thanks very much.